This is a CBS News Special Report. I'm Tony Dokoupil in New York, and we bring you breaking news from the White House, where President Joe Biden has tested positive for COVID-19. We are told that the president is experiencing mild symptoms, and he is positive after a negative test Tuesday. And despite being fully vaccinated and twice boosted, he got that second booster shot on March 30th. For more on what we know at this hour about the president's condition, how he may have contracted it, let's go to the White House and Caitlin Huey-Burns, who is standing by for us. Caitlin, good morning. They're saying mild conditions. That's what we have in the statement from the White House. Do we know anything more?
Hi, good morning, Tony. Yes, mild symptoms is how the White House is describing it. They mentioned that he was last tested for COVID-19 on Tuesday and tested negative at that point. We are also learning that the First Lady tested this morning, and she has tested negative. She is heading to Detroit. The president was expected to go to Pennsylvania today for a campaign, for an event to talk about gun proposals and fighting crime. He was also supposed to have a fundraiser later this evening. We are told that the president is now in isolation according to CDC protocols, and he is going to continue to be in isolation until he tests negative. They are also working on contact tracing, so talking to everybody with whom the president was in close contact. That means staffers, that means members of the press. Remember, he was just on a trip abroad. He just returned from Saudi Arabia on Sunday morning. So contact tracing will be going on, but they say these symptoms are mild, that he will continue in isolation until he comes with a negative test. Tony.
All right, Caitlin, thank you very much. Also joining us is Dr. Celine Gounder. She's an epidemiologist and CBS News contributor. Dr. Gounder, the president, as we said, is fully vaccinated. He's been twice boosted. Symptoms are, in fact, not just mild, but very mild, according to the White House, and he's begun to take Paxlovid. However, he's 79 years old. That is a risk factor. What should people know or think about the president's condition?
I think it's very reassuring that, one, he's been double vaccinated and double boosted. He is a healthy 79-year-old with no, to my knowledge, chronic medical conditions. So chronic medical conditions would include diabetes. He's clearly not obese. Those are the kinds of things that really put you at risk for severe disease. He also has started Paxlovid, which we know further reduces the risk of hospitalization. And of course, he would have access to monoclonal antibodies should his condition deteriorate in any way.
We have the president's health report from the White House doctor from 2021. He does not use any tobacco products, according to that, does not drink alcohol, works out at least 5 days a week. So given the background that's been made public about this particular patient, patient number one in this country inside the White House, how long might the president be in isolation out of a normal working situation?
We're seeing people with this Omicron subvariant, the BA.5 subvariant, takes about 10 days on average. You know, everyone's a little bit different. Some people will be a little bit shorter, some people a little bit longer. But 10 days is really the average for people to recover and become test negative.
All right, Dr. Celine Gounder with some context and background on the coronavirus and this particular patient, what we know publicly. If you're just joining us, we came on the air to let you know that President Joe Biden, according to the White House, has tested positive for COVID-19. He is taking Paxlovid at this time and is experiencing what the White House describes as, quote, very mild symptoms. We will, of course, be following it, and there will be more to come on your local news on this CBS station, also tonight on the CBS Evening News. Many of you will now return to CBS Mornings. This has been a CBS News Special Report. I'm Tony Dokoupil, CBS News, New York.